Thank you to everybody.
Excellent. Okay, so welcome everyone on behalf of CEPS to this webinar. I am Sergio Carrera. I'm a senior research fellow at CEPS, and I'm also a professor at the Migration Policy Center at the European University Institute in Florence. And it's really a pleasure to welcome all of you and to be chairing this event. We will be dealing with the coronavirus and border restrictions in the European Union and the implications of COVID-19 policies in as regards Schengen, the free movement of persons, and also the right to seek asylum for people looking for or in search of international protection. Now, we've seen that border restrictions have been one of the most popular policy responses by European Union governments across the board in what has come to be a very complex web of policy restrictions, very unclear also and very inconsistent when looking at them together, and opening very important questions for all of us, for all our freedoms and rights as EU citizens or residents, but also most importantly as well, for those people who are legitimately looking for international protection in the European Union. Now, when assessing public policies by states, of course, the need for those policies to be proportionate is very important, based on evidence, on health professionals' views on the proportionality of these policies, but also equally relevant is the legitimacy in a democratic society of those policies, meaning that those responses do not undermine in a very intrusive way, in a very disproportionate way, fundamental rights and the rule of law. Now, this COVID-19 pandemic is arrived also in a time where the European Union was reflecting on how to reform the Common European Asylum Policy. And we wondered and wanted to take this opportunity today to reflect together as to the extent to which we have new evidence calling for such a reform, particularly in light of ongoing processes at international level, such as the United Nations Global Compact on Refugees, which is the international reference framework for refugee protection policies, and also looking at how that compact and also at the European Union, this call for solidarity, fair and solidarity-based distribution of responsibility on refugee protection is so important, and keeping also human rights and refugee protection at the top of the agenda. Now, this webinar falls within the context of a project that CEPS is coordinating, and I'm responsible for this project at CEPS, which is called ASILE project. ASILE meaning protection, refuge, and looking at global asylum governance and the European Union's role. And it's a 4-year project with an excellent consortium of universities around the world. We also have the United Nations High Commissioner for Refugees and the Danish Refugee Council as partners. And this project offers us this possibility today to have this kind of high-level policy meeting. We just launched our new website. I invite all the participants to join us in asileproject.eu and subscribe to our project newsletter. So, as I said, I will be chairing this meeting. Very briefly, the rules of today's webinar. So we will be running for 1 hour. And we will start with the keynote of Commissioner Ylva Johansson. We are delighted to have the Commissioner with us. It's really an honor to come with her. She will be addressing the Commission's priorities in this area, and then we will move to the 3 discussants. We have 3 excellent discussants, and I'm also very delighted and happy that they could join us. So thank you to all. Starting with Tini, member of the European Parliament and also a professor at the Center for Migration Law in the Radboud University of Nijmegen, the Netherlands. Then we have Michael O'Flaherty, director of the EU Fundamental Rights Agency, the FRA, in Vienna. And then we will have Marta Hirsch-Siembinska, which is the head of unit in the European Ombudsman. So without any further ado, also briefly on the questions, we want your feedback and your questions, but we will need to organize it as follows. You have the Q&A option in Zoom. So after the keynote speech by Commissioner Johansson, please start feeding your questions in written in that option. Please limit it to one question and specify to whom that question is addressed. And we will be selecting those questions, and I will try my very best to select them and to bring them back to the panel. Okay, so I count with your understanding on handling the Q&A as well. So without any further ado, I give the floor now to Commissioner Johansson. Commissioner, you have the floor.
Thank you very much. I'm very happy to be here with you because I very much appreciate CEPS commitment, expressed not only by this event, but also by Thursday's event on the right to assist refugees. I think it's good to have a measured and civil debate on migration and asylum. This is something that is sorely needed and too often sadly lacking. I want to discuss with you the impact of the virus, first on the border situation and the future of Schengen, but second on refugees and the future of our EU asylum and migration policy. To me, it is clear that we, the European Union, need to welcome those who can help and to help those who need a safe welcome. Both these policy areas, borders and asylum, touch upon core values, fundamental rights, the freedom of movement and the right to international protection. In both cases, the virus put these values under pressure. In an uncoordinated way, member states introduce border controls. Similarly, they slow down asylum procedures. But the nuance is important. This is because of the virus. We face restrictions in all aspects of our lives right now. In both cases, the Commission acted swiftly to reverse the damage, forge unity in Europe, and point the way forward. In both cases, we are already working on reforms before this virus hit. The last 8 weeks have made the urgency of change more acute. So let me discuss both in more detail. First, Schengen, then asylum. Before COVID, a majority of Europeans traveled to other EU countries for work, education, shopping, and holidays. Europeans consider freedom of movement their most cherished right, and Schengen one of our greatest achievements. Many member states now have reintroduced travel restrictions and border controls at the borders and inside countries. In many member states, you are not allowed to visit friends in a different town or go away for a weekend. I get dozens of letters from desperate people. I'm in Austria, we're in Greece, Poland. How do I get back home to Bulgaria, Germany, Slovenia? We are pensioners and about to move from Spain to France. How do we get home? My partner cannot witness the birth of our child. The Commission has issued guidelines to keep the flow of goods and medical supplies going and to help workers to go to their jobs across the borders. To reduce queues at borders, to help people to get home, I've been in constant touch with member states through video conferences of the COVID-19 information group, via ministerial video conferences, and through many bilateral contacts. I must say the situation is now stable, but it does not mean it's acceptable, preferable, or viable for the future. People are sad and frustrated, which shows that free movement has become part of our everyday lives. I think sometimes you don't really miss something until it's gone. COVID-19 teaches us what Europe would like without free movement. Perhaps what's closest in the experience of many millions of Europeans in Central and Eastern Europe, who remember being unable to leave their country or region, cut off from friends and family. It's a bit like traveling in a time machine to a dark and distant past. Now we need to get back to the future, back to normality. I want people to be able to travel again, for business, pleasure, and to meet friends and family again. But we need to learn how we can travel in a safe way. Last week, I discussed the situation and the way forward with the Ministers of Interior of all EU and Schengen member states. We agreed on the extension of the temporary restrictions on non-essential travel to the EU until the mid-June. And regarding the internal borders, The primary condition for lifting travel restrictions and border controls is the spread of the virus and the capacity of the healthcare system. Other preconditions are containment and physical distancing measures, and health security requirements for travel and hospitality. We want gradually to remove obstacles, ideally across the whole Union, but where this is not possible, we should start by allowing travel between regions, areas, and member states where the health situation is evolving in a positive way and the situation is similar. Member states will first lift restrictions to free movement at home. Once member states allow travel to an area, they may not discriminate. That is essential. Neighboring countries should lift restrictions based on objective criteria related to the virus, not on nationality or proximity. If a member state lifts restriction on movement to and from another member state, or regions or areas, this must apply without discrimination to all EU citizens and to all residents of that member state, regardless of their nationality. Any remaining restrictions should be proportionate and non-discriminatory. For example, member states can replace systematic internal border controls by police measures or controls based on risk assessment. That's much more in the spirit of Schengen. Whatever the case, member states will need to inform other member states of restrictions they are lifting. They will need to work closely together. I will remain in constant contact with ministers as I have done throughout the crisis. In the long run, we have to do better than a return to the old normal. 5 member states signed the Schengen Treaty in 1985. The Berlin Wall was still standing then, and the internet did not yet exist. We need to update and further strengthen Schengen, including its legal framework, to get ready for the challenges of today and tomorrow. To begin with, I want Bulgaria, Romania, and Croatia to join the Schengen area. I want to build a well-functioning Schengen based on trust among member states and a correct and efficient implementation of the Schengen acquis. Problems in one member state can affect all member states and could put the Schengen area at risk. To restore trust, we need well-managed external borders and good relations with third countries, including an effective Schengen visa policy. Third country nationals must be able to come to the EU again. Our economy, as well as the tourist sector, needs them. We need a stronger European approach on internal security to prevent and combat crime in these increasingly digital times. And we need a common European approach to asylum and migration. I will address this in our upcoming pact. Now to asylum. What is most essential is the right to asylum. COVID or not, everyone has the right to an individual procedure and should have full access to their rights. The Commission issued guidance to ensure procedures continue and rights are respected, and guidance on the use of digital technology in the field of migration. For example, online interviews with asylum applicants. COVID is speeding up the digital transformation of the world. Digital technology may open up possibilities for streamlining national asylum and migration procedures. It could also help to develop more uniform procedures so that we can grant protection or resettle people much quicker. As I am shaping the pact, I will look into these lessons to modernize our procedures, to adapt them for the challenges facing us. Despite the crisis threatening our health, our economy, and our society, there is also solidarity. Take the lonely children and teenagers living in camps on the Greek islands, in conditions that were unacceptable even before the virus came. Recently, 12 of those unaccompanied minors found a new future in Luxembourg. 47 found a new future in Germany. And we are on track to carry out a relocation of 1,600 unaccompanied minors to more than 10 countries in the coming weeks. And also according to the old and the sick people, most at risk from the virus, living in these overcrowded camps. We are making progress on relocating them out of these camps on the islands. 1,000 vulnerable people were moved out of the camps last month. Last week, an additional 390, and this week, 600 more will follow. We have a moral obligation to help refugees and migrants. But refugees and migrants are also contributing to our societies. On average, 13% of key workers in Europe are immigrants, people born outside their member states. In my country, in Sweden, 1/3 of the doctors are born in another country, and 70% of the care workers. COVID really opens our eyes to how much our societies depend on migration. We urgently need people to help with the harvest. Governments all over Europe are mobilizing everyone to dig for victory. Students, the unemployed, and also immigrants and asylum seekers. Italy will likely soon allow 200,000 undocumented people to work. The German Minister of Agriculture wants asylum seekers to work. Portugal has given asylum seekers and migrants full citizenship rights while the crisis lasts. And people also want to contribute. All over Europe, asylum seekers and refugees are volunteering. In Portugal, Italy, Germany, and the Netherlands, they are cooking meals, delivering food, making masks, disinfecting supermarket trolleys, and cleaning hospitals. And asylum seekers with medical training are stepping forward. Like Tamon Mark Andang Asongwe from Cameroon. As a qualified nurse, he's taking care of all people in a residential facility in Greece. He says he wants to do something back for Greece. But sometimes people aren't allowed to help, even people with medical training and years of experience, because their qualifications are not yet recognized. Jose and Jessica are asylum seekers from Venezuela in Spain. They are both doctors, but forced to sit at home. Bayan Ustvani from Syria can't practice as a pharmacist in France. In Germany alone, 14,000 foreign doctors are waiting for a green light on their qualifications. So it's good news that Spain is prioritizing the approval of doctors and nurses. The Irish Medical Council wants qualified refugees to help as support staff. The German states of Bavaria and Saxony are recruiting medically trained migrants to work as support staff. And many migrant doctors and nurses are already fighting the virus, sacrificing their lives to save others. In France, it's not only Justine, André, and Jacques who appear in the lists of the medical dead, but also Mahem, Kabkeo, and Sami. There are 20,000 foreign-born doctors working in Italy. The 100th doctor to die in Italy. Samar Sinjab was born in Lebanon. She contracted the virus from a patient and died in intensive care. And family doctor Abdel Sattar Arud came out of retirement to help, became sick himself, and died. And these are just a few brave people from a few member states. They worked and died alongside their colleagues to save their patients. Here in Belgium, we applaud our key workers at 8 o'clock every evening. I will applaud them again tonight, all of them. So in conclusion, in the beginning of the crisis, there was an impression that member states panicked. They imposed border restrictions and slowed down asylum procedures. I call it the pasta and toilet paper phase. When the crisis hit, people bought pasta and toilet paper and locked their doors. But they soon realized that this was not the way forward. They needed good neighbors and cooperation. And member states also quickly realized they need each other and they needed the coordination from the Commission. COVID shows us how much migrants contribute to society and are already part of our society. That's why I am confident about our upcoming Pact on Migration and Asylum, which builds on the idea that migration is normal, something of all times, that we need to manage rationally by working together. The corona crisis is the worst we have ever seen, and the recession is the deepest one in EU history. It has a massive bad impact on our lives, on our health, on our jobs, on unemployment, and on our economy. We must do everything we can to fight the crisis. We must flatten the curve of infection, soften the blow to society, and work towards recovery. But there is one thing we must never do. We must never allow this crisis to undermine our fundamental rights. The rule of law, democracy, freedom of the press, and the right to asylum. Thank you.
Thank you, Commissioner, for this wonderful speech and for bringing forward the importance of EU values and member state commitments with or without COVID-19 must be upheld. I think this is a very important message, very welcome message, and also for sharing with us the individual stories of brave people you were referring to, those brave people, and the need for their dignity and rights to be upheld in an uncompromising way. So thank you very much, Commissioner, for your speech. I will now move directly to our discussants, starting with Tineke Strick. Tineke, you have the floor.
Thank you very much for the invitation, and I'm also very happy to hear the speech of Mrs. Johansson that really shows a very positive and optimistic view on the future of Europe's asylum policy. I think that we are all aware at the moment that if we really effectively want to combat the virus, that we cannot leave any member state, any person behind, that we need to include everyone. But at the same time, we are aware, I think, that solidarity and cooperation cannot be taken for granted. We really need to work very hard on it. And we knew that, of course, in the asylum policy for a long time already. It is very difficult to really get enough political will to get solidarity, which we really need, not only for the specific member states who are overburdened, but also for the asylum seekers who are stuck in those countries. And I think actually that the COVID crisis has even exaggerated this situation. I mean, we have seen the overcrowded camps. They were already undoable at the Greek islands, but now they have really become dangerous to the asylum seekers due to the overcrowdedness, the lack of space for isolation, lack of sanitary services, and lack of health care. And the European Parliament therefore sent a letter urging member states to show more solidarity, and urged also the Commission to really undertake measures for preventive evacuation. Of course, it's true what Mrs. Johansson said. We have had pledges from member states, but if you compare it to the need, it's pretty marginal. We have 42,000 people on the islands, and we have now 1,500 pledges. And even if that's so limited, it immediately has had an impact on solidarity with other member states. We had, of course, due to the closing of the Italian borders, our harbors last year, we had the Malta Declaration, where a number of member states were prepared to take in some asylum seekers. Now they have turned their attention to Greece, and as we understand that this year for Malta, there has been no relocation at all. And asylum seekers maybe also therefore are not only the victim of bad reception conditions, and the lack of relocation, but also by attempts of those countries under pressure to avoid their responsibility. We see the closing of ports, we see the pushback actions taking place and increasing, and this of course affects asylum seekers' right to asylum, right to human dignity, and even their right to life sometimes. We just recently, we heard a Maltese official revealing that under the instruction of the government of Malta, that he was involved in pushback actions from the Maltese waters into the Libyan search and rescue zone. And that was even in a time where Frontex and also the Commission knew that the Libyan Coast Guard did not operate fully at that moment. That was during the Easter period. So that actually meant that those pushbacks were not only dangerous because of returns to Libya, but also dangerous in the sense of the risk of being drowned. So pushback take place at a lot of member states who are bordering the Schengen area and bordering the European Union. If you think of Greece, Turkey, Croatia, Bosnia, Spain, Morocco, Bulgaria, Turkey, we have a pretty well overview right now of where it's taken place. And but also the level of violence seems to only increase. We know that from Croatian, the violent pushbacks, and only recently we had it revealed that at the Greek-Turkish border at the 4th of March, the Greek border guards really have shot at migrants, just innocent migrants with live ammunition. Only this morning, the European Parliament, more than 100 MEPs, send a letter to the Commission urging for a thorough investigation, because we really think that those violations cannot pass without any response, any thorough response, as impunity will lead to much more of these practices in future. So if you really want to prevent these violations in future, we should fundamentally improve the fundamental rights monitoring at the border, make it independent, make it transparent, and really impose sanctions to non-compliance. And that would also apply for us regarding the application of all rules of the Common European Asylum System, in order to make sure that all asylum seekers have the same treatment and the same protection wherever they are within the European Union. But I think that all these measures, pushbacks, shifting responsibility, can only be effective once the responsibility is really equally divided among the member states. And in the new pact, a successfully established and implemented solidarity is really key. I'm really looking forward to the proposals of the Commission in that regard. We think that it can only be successful if the principle that the first member state of entrance is responsible will be abolished, because otherwise there will be still an overburdened situation for those member states. And also if member states, municipalities, regional authorities are really financially supported in inviting and physically relocating asylum seekers. Not only financial support for the procedure or reception centers, but for the whole integration process afterwards. And if member states who do not offer pledges pay for those costs. I think that in a fair distribution key, also resettlement pledges and voluntary relocation should be taken into account. And if that would not be sufficient in the end, we think a mandatory mechanism cannot be absent. We need to have some last resort measure because otherwise we will not fundamentally change the situation that both asylum seekers are stuck in bad circumstances and member states at the external borders cannot cope and cannot set up an effective and protective system. So that's the proposal also of the Greens Eva that we released this morning. And we really hope that this can be taken into account by the Commission. And I really hope that that we will come up with fundamental changes in the solidarity system, because if not, I don't see a real sustainable future for a common European asylum system. Thank you very much.
Thank you very much, Tineke, for pointing out also the work of the European Parliament and highlighting the importance of monitoring on the ground as regards member states' compliance with EU commitments. At CEPS, we have actually proposed the idea of having a stress test of the Common European Asylum System and Schengen, which at the moment doesn't exist, to precisely provide this kind of information, qualitative and quantitative information on the implementation of these policies. Thank you very much indeed for your input. Now, Michael O'Flaherty, Director of the Fundamental Rights Agency. The FRA is doing a fantastic job and research and also monitoring what is going on in terms of the impact of current policies on fundamental rights. Michael, we look forward to hearing from you.
Thank you very much, and thank you to CEPS for both the initiative of the event and for the invitation. If I could just begin by acknowledging the extent to which COVID is presenting extraordinary, of historical significance, fundamental rights challenges. right across the breadth of every aspect of our human well-being and experience. The Fundamental Rights Agency is committed to continuing to closely monitor these developments across every sector, relevant obvious to EU competency, and publishing them, for example, in the new COVID-related monthly bulletins, first one in April, next one upcoming in May. We're also continuing to be engaged in the migration context, including on the ground. The last trip I made before the lockdown of all our travel in March was to Greece. Because of our great concern about the situation as it then was there. I'd like to focus my observations exclusively today on the external borders. I want to make 2 words of appreciation, 2 words of acknowledgement, and I'd like to express 3 red lines. The first is the appreciation. I want to acknowledge the leadership being offered to us by the Commission right now in the form of Commissioner Johansson and her people. I feel led right now. I feel led through a pathway of principle, and I think we have to give the Commission every possible support as it navigates through these impossible times, including in the context of the launching of the Pact. My second word of appreciation is for all of those involved, member states and Commission and others, in the resettlement efforts that have continued notwithstanding the crisis. Yes, the numbers are modest, but the targeted community, unaccompanied children, is a highly vulnerable one, and every life rescued is worth the effort. I'm very glad that the Fundamental Rights Agency was able to support these ongoing resettlement efforts, including through launching of research materials on what it takes to achieve the resettlement, for example, of an adolescent boy. There's still a long way to go, but we should acknowledge this achievement. Turning to the acknowledgement, moving from appreciation to acknowledgement. Again, I have nothing new to say, but I think it must be indicated from the outset. First, we have to acknowledge the crisis. We have to acknowledge the unprecedented nature of the COVID crisis and the extent to which it complicates everything we do. That being said, of course, it cannot be an excuse to do nothing. And secondly, in a form of an acknowledgement, and this is a point I could have made this year, last year, the year before, but hopefully not next year. And that is, we have to acknowledge the continued lack of solidarity within EU member states. Taking a few thousand children is good, but it's not enough. We have to have a meaningful responsibility sharing with the countries most impacted, Greece and other countries who have had to take far too much of the burden. And until there is a meaningful solidarity across member states, we will ultimately be applying sticking plasters to a grave wound. If I may turn then to the 3 red lines. And these are, as the Commissioner put it, these are red lines, COVID or not. The first of these is the legal obligation to consider asylum claims, to do an individuated consideration of asylum claims. The possibility of making an asylum submission and having it considered has been closed off in a number of places. This is a straightforward violation of international law. And I welcome very much the fact that the suspension of the procedures in Greece for March was not continued. There are creative ways in which to consider asylum claims, even when a physical encounter is not possible. There are online methodologies, there is formal extensions of time limits. There are ways to get around the very real challenges. The second of the red lines, again, as has been mentioned earlier, is the absolute unacceptability in any rule of law society of pushbacks. The reports from the Mediterranean of boats being pushed out of European waters are deeply disturbing, considering the extent to which we pride ourselves in being human and fundamental rights respectful states. And they can never be tolerated. They violate not just human rights and fundamental rights law and EU law, but also basic tenets of the law of the sea. And third, and the final of my red lines, has to do with treating people in our reception facilities to basic levels of human dignity. The point has been made earlier by other speakers, but again, it must be reiterated time and again. Those of you who have visited the facilities, for example, on the Greek islands, know what I'm talking about. The conditions are beyond deplorable, and they get worse, not better. And now, with the separation of new arrivals and people suspected of possibly carrying the virus, things are even worse again. Again, they're not acceptable in the Europe of which we seek so hard to be proud. Let me wrap up by reiterating something the Commissioner said in her closing words. She made a crossover to what is, in the EU context, another debate, the debate about rule of law. They're the same debate. Honouring the red lines I've mentioned is to honour three fundamental legal and human rights obligations. It is the acid test of our ability to deliver on rule of law states. Thank you.
Thank you, Michael. The Europe that we seek so hard to be proud. I think that's a very important message and links to Tineke's points before on the rule of law. That in addition to fundamental rights, the importance of upholding the rule of law, even in the context of border policies at EU level, they must go hand to hand. And it boils down to indeed respecting human dignity and access to procedures and remedies to everyone, as the Commissioner also was pointing out before. Speaking of good administration at EU borders, the role of the European Ombudsman is absolutely fundamental. We are very happy to count with Marta in this panel and look forward to hearing the work of the Ombudsperson in this. Thank you. Please unmute yourself.
Okay, sorry for that. So again, thank you myself as well for having invited the European Ombudsman to take part in this webinar. Very important nowadays, the discussion we have now. And as we speak now, right now, the European Ombudsman, Mrs. O'Reilly, as a chair of the European Network of Ombudsmen, is now virtually meeting her counterparts from the member states to discuss their experiences with the measures undertaken by national administration in response to COVID-19 pandemic. But we have contacts with national ombudsman all the time, and what we have heard from national ombudsman so far, that their main concern is first that the temporary measures affecting human rights have to be proportionate and justified. Second, we heard about the risk that the current exceptional administrative procedures may last after the pandemic. While emergency powers can be legitimate if granted in the need to protect health and safety, we all know about that. Unfortunately, history teaches us that states commit abuses in times of exception. So after the lockdown, it seems that two tasks will become crucial for the national ombudsman perspective. And as you know, many among them are national human rights institutions. First, rolling back unjustifiable restrictive measures, such limiting access to asylum procedures and movement restrictions, but also consolidating some of the more surprising positive measures. Let's say the easing of detention regimes or expanded access to work for medical doctors, for instance, as was mentioned by Commissioner Johansson. The European Ombudsman role is limited, however, to what was done, what could be done by European administration. Some of those who are with us today may not be familiar with the role of European Ombudsman, so I would just like to briefly outline the basis of our involvement in the area of asylum migration. The Ombudsman mandate is set in Article 228 of the Treaty on the Functioning of the European Union, and this article allows us to investigate maladministration in the activities of the European institutions and bodies, on basis of complaints, but also ex officio and the Ombudsman initiative. Therefore, as you can imagine, the European Ombudsman has no power to take action against individual member states that in response to COVID-19 pandemic are, let's say, effectively suspending the right of people to seek asylum or that are failing to protect the most vulnerable seeking asylum in the EU. The Ombudsman can act only against European institutions and bodies, but her recommendation can be used to bring about changes in the European Union legislation. One important addition I would like to underline is that the Ombudsman, the European Ombudsman, can invite national and regional ombudsman in the member state to conduct their own investigations in parallel to the European Ombudsman investigation and the matters which involves at the same time the European Union administration and the national administration. The Ombudsman has already conducted a number of inquiries in the area of asylum migration. I will mention few, very little, very small. I have not much time, but just the inquiries concerning Frontex, for instance, the European Border Agency, related to joint return flights. And in this investigation, we conducted in parallel with the investigations of 17 national ombudsmen. Another inquiry concerning Frontex, which led to the establishment of internal complaints mechanism by Frontex, a novel internal ombuds-like procedure. The Ombudsman also conducted inquiries against the Commission concerning the European Union-Turkey deal, and also against the ASO about the conduct of experts' interviews with asylum seekers. The Ombudsman has not received up to date admissible complaints concerning the European Union administration behavior in state of COVID-19 emergency. There are certain issues which could be brought eventually to the Ombudsman. For instance, as to whether exceptional measures and procedures implemented by Frontex, EASO, Europol, and EULISA respect fundamental rights. How does Frontex currently ensure that doesn't engage in refoulement in the European Union borders? How does EASO encourage, support effective access to asylum procedure in notably Greece and Italy? Another issue may be the use of new COVID-19 technology in surveillance and its impact on fundamental rights in migration asylum context. And the question how the pandemic may enable Frontex, EASO, Europol, EULISA to justify the increased use of smart borders, biometrics, big data. There are many questions which should come to the Ombudsman very soon. From our perspective, the accountability of the European administration, and I speak here specifically about European agencies, I mentioned already, specifically EASO, is essential, and therefore the law must be clear about their role. It's essential that those involved at the European Union level ensure procedural rights of asylum seekers and migrants, right to be heard, right to effective remedy, right to legal assistance, I mentioned few. And it's essential that administrative processes are fair and effective. And what we learned from our investigation is certainly that the human dimension of migration cannot be overlooked if the dignity of migrant is to be fully recognized and respected. Thank you, and I am open for questions.
Thank you very much, Marta, to bring into the fore the importance of accountability in the legitimacy of policies, how important it is to ensure this accountability for legitimizing the role of, for example, EU agencies on the ground, that indeed they coordinate, but they are also co-responsible for what happens. They play a very important role, but it's also fundamental that those values that we are discussing today are also upheld in their activities. Very difficult. So thank you very much to all of you. We've already received a number of very interesting questions by our participants. I would like to come back to Commissioner Johansson with a couple of them, also linked to some of the comments pointed out by our discussants, particularly a couple of them, and also a few questions referred to this new pact on migration and asylum. Is this an opportunity really to solve the deadlock, to revise the EU Dublin regulation, really to move towards a meaningful, I think was Michael mentioning, meaningful responsibility sharing, and Tini as well, when it comes to sharing responsibility, when it comes to asylum seekers between member states. There is also one question more, Commissioner, from the citizens' perspective and the non-discrimination that you highlighted. Few of our participants in the event have referred to citizens' trust, how to regain the trust among citizens, many of whom feel frustrated or abandoned and have received a lot of criticism also about the role of the European Union, sometimes unjustified. Different rules by each Ministry of Interior restricting differently their rights and liberties, how to make sure that these people are indeed not discriminated on the ground. How some participants are asking, what exactly can the EU do to ensure that citizens are not discriminated? If you would like to comment, thank you.
So this, first I start with the second one on the trust. Of course, this is really a fundamental issue right now, because we are going through a crisis worse than any crisis we've seen or been through before. So this really affects our societies deeply, and it will, if you ask me, I guess it will affect us for a very long time. So we need to learn to live with this new situation. And then, of course, I think that, as I said in my introduction, that I think I had the impression that many member states panicked from the beginning. And I think that was also what many individuals did. And then step by step, we are coming back to more of cooperation, more of coordination, more of opening up, and more of solidarity. But there are still a lot of steps to go until we can say we are in a situation that it's good to continue living in. So I think I mean, of course, I can't really answer the whole question, how should citizens, how should we have the trust from citizens, but I think that transparency is important. The fundamental values, rights, rule of law is really important here. And also, I think that from the Commission and from governments to be open about, there's a lot of things we don't know here. We don't really know so much about this virus. We are learning every day, or at least every week, how this develop. And I think it's very important to be able to adjust the measures when we learn new things. So I think this is also important, not to give the impression that we are for sure know things that we actually do not know. So we need also to work very close together with scientifics and also with health authorities in this aspect, and how we can learn with this. But I think it's for me, it's very important that we make the clear distinction that there's a lot of restrictions right now. We are not living our lives as we used to live them. There's a lot of restrictions, but we have to make the clear distinction on restrictions on how we can live our lives with, and also, but we can't afford restrictions on fundamental values and the rule of law and the rights of individuals. So this is really important to make that distinction, I think. On the new pact on migration and asylum, that was my task from the beginning. And my task was not really to find the best proposal, because maybe the best proposal already has been on the table. I don't know. The problem is that to find a proposal that is possible to accept, so that it can come to real legislation and come to be realized. And I think Trinike said that very well, Trinike Strick here, that we need all member states on board. And this is, of course, part of the difficult task. We need all member states on board, and we need Parliament and the different aspects on board, and a lot of other stakeholders that are here. And this is, of course, a very difficult task. It was it already from the beginning. But I have reached out to all member states, to all ministers bilaterally, and have talked to them. I traveled a lot before, but when we still could do that. I've reached out several times to different part of Parliament, to a lot of other stakeholders. And I do think it's possible to find a compromise that can be accepted by everybody, and that will really improve our common migration and asylum policy. Maybe it will not be the best one ever, but it will for sure be much, much better than the situation we have today. And for me, as a politician, it's really important that we do not let those that have the least ambition on migration and asylum to be able to set the standard. And when we are accepting a blocked situation, this is actually what happens. So for me, it's very important that we show that we can do this. And as I said also earlier, migration is a normal thing. Migration has always been here. Migration will always be here. And to be honest, without migration, we will be we will be lacking prosperity and a lot of other things in our societies. People with migrant background are playing a crucial role in our societies right now. So our task is not to say yes or no to migration, it's to manage migration in an orderly and good way. And that we have to do together. But it's also important to see that we can't do it without reaching out also to other countries around us. Because for me, I would like to have fewer irregular arrivals, but then we must open up for more legal pathways to Europe for those that are not in need of international protection, but also can contribute to our society. So I think it's important to have ways both for legal migration and, of course, for the right to asylum and international protection. Thank you.
Thank you, Commissioner. I see some of our discussions that would like to intervene, but before that, just briefly, indeed, some of our participants are highlighting this point you mentioned just now about the potential role of the United Nations Global Compact on Refugees to look for these international and regional approaches, common finding approaches to this matter. So I have Tineke and Michael. Tineke, would you like to start?
Yes, thank you very much. Yeah, I think the relation between rule of law, what was mentioned by the Commissioner, and the crisis that we see at the border is very much linked, of course. And if we want to have an effective policy towards respect for fundamental rights, so no impunity anymore, that has to go hand in hand with more solidarity, because you cannot say to Malta, you're not allowed to be involved in pushback, and at the same time just leave them with the asylum seekers. So this really should go hand in hand. And indeed, as you said, Sergio, the Global Compact on the Refugees, that was an official declaration that we need to have more solidarity and it need to be rearranged. And at the same time, with the Corona crisis, you see even more arguments or justifications to show less solidarity. I mean, it doesn't work, you know, as an incentive to come up with measures that we can solve the problem together. So therefore, I think we very much depend on good legislation, policy measures. But I agree with Mrs. Johansson, you need political support for that. I mean, otherwise we will not have it adopted. Actually, I'm very happy that what I see in the European Parliament, also with the current positions of the political groups, that they all emphasize solidarity as a prerequisite for the new pact. So I really hope that's very clear over there, what I already said with abolishing the first member state's responsibility. And I would like to briefly refer to the important remark Michael mentioned about the suspension of asylum requests. I think it's very important that we put a halt to that. It has been put a halt in Greece, but also I heard Mrs. Johansson said at a certain moment that she wants to explore if in times of crisis or exceptional circumstances, we need a prolongation of that time limit that we have now for 16 working days. I really hope it will not be part of that new pact, but instead an emphasis that also during the suspension of the max of 16 days, which need to be justified, there will be the Reception Conditions Directive being applicable. I think we have enough technical possibilities to take in asylum requests in time. Thank you.
Thank you, Tineke. Michael, I received also, in addition to the comment you would like to put forward, a couple of questions that perhaps you can also bring some light on. The point on non-discrimination, how to ensure this implementation of non-discrimination of EU citizens. And some participants are also highlighting about the risks of increasing digitalization and the surveillance of both EU citizens and asylum seekers. If you could develop on these points.
For sure. Thank you very much, Sergio. Indeed, I wanted to come back on the issue of discrimination. From our work in the 27 member states in these weeks, we see a growing problem of discrimination. It is on the rise against minority groups. It's particularly worrying in terms of COVID-related. It's particularly worrying for the Roma community. They're being blamed for spreading the virus. They're being given harsher lockdowns than other people within the general communities. Jews. The World Jewish Congress issued a shocking report recently showing how Jews are again also being targeted as somehow responsible for the situation we find ourselves, and various categories of minorities, including those perceived to be Muslim or those perceived to be of sub-Saharan African origin. So we do have a problem, and it's not getting better, it's not stable, it's getting worse. But there are some things that are clearly evident that could be done right now. The first is we need leaders at the national level in particular to repudiate loudly the patterns of discrimination, to tell our populations it's intolerable, unacceptable. Secondly, we are charting problems of profiling of members of minority groups, COVID-related profiling by security forces. This can be tackled by the state. Third, there's massive underreporting of acts of harassment and discrimination. And again, we have to keep reinvesting in encouraging impacted groups to tell their story, confident that something will be done with their story. Fourth of the five, prosecute. Again, I could have said this before COVID. It's a general problem we have in some parts of Europe that we do not prosecute hate speech and hate crime. And finally, this is a moment to reinvest in our equality bodies. They're well placed to be a primary fighter against discrimination. They need more attention, more centrality, more resources. And finally, on the topic of digitalization, I guess this is particularly in the context of apps, tracing and so forth. We will issue a report this month, May, on the issue of apps, tracing apps, and the fundamental rights matters that arise. There is a legitimate role, but it has to be balanced by a proper respect for privacy and other rights. They're not absolute rights. It's not a zero-sum game. The state has got to be able to trace the infections, but it can be done in a way that's respectful of human rights. Issues arise such as where you store the data. Is it centralized? Is it kept remotely? And as I say, we'll unpack many of these this month to help the policymakers in the member states as they adopt the policies and adopt the laws so that they can serve the social value without trampling over our fundamental rights.
Thank you very much. We are 1 minute to 2 o'clock. I think we need to put a closing to this very fascinating exchange, and you've all pointed out very cross-cutting actually perspectives on how to approach these issues, and also how COVID-19 perhaps has not created new challenges. It has brought new light into already existing long tail existing challenges, and in some cases has exacerbated those very challenges, such as the situation of asylum seekers, of specific minority groups across Europe, and discrimination. And the rule of law has been omnipresent in our debate as to the way forward. Just to anticipate that on the 25th of May, we will have another webinar with Commissioner Jourova on the aspect and the subject of apps and surveillance in the name of COVID-19, very important subject, but also a risk that we see very plausible in the name of COVID to make EU citizens and non-EU citizens subject to very intrusive policies, and it's not a zero-sum game, as Michael was saying. And so thank you very much, Commissioner. Thank you very much to all of you, to all the discussants, the participants who have been following this webinar. Warm thanks on behalf of CEPS, and see you soon. And don't forget to check the ASILE project website and subscribe to our news. Thank you. Bye-bye. Bye-bye. Thank you, everyone.